And this is too. Young people, watch out. Your health care costs are going through the roof. And a big driver of that increase, surprise, Obamacare. So what can you expect in the months ahead as the law goes into full effect? With us now, Avik Roy, Senior Fellow at the Manhattan Institute. Avik, welcome back to the show. So let's say you're one of those 25 to 34-year-olds out there. You cheered Obamacare because you thought it was going to make the world a better place. What's going to happen to those folks' health care costs?
They're going to double in California, by and large. In some cases, they may be more than double compared to what you could buy on your own today in the private market.
Well, you know, former CBO Director Doug Holtz-Eakin came up with some estimates of what younger people are going to pay on average. He says 169% more. Average premiums higher here. Does that sound about right to you? Or, I mean, not right, but do you think it's correct?
I think on average, that's what the data that I looked at also suggested. Now, what you hear from liberals is, well, it doesn't matter because some people who are really low income will be protected because Obamacare's subsidies will subsidize the cost of their insurance. But that's only true for a small fraction of the people in that age bracket. The vast majority aren't going to be subsidized, or they're going to get a partial subsidy, but they're not going to be insulated from these increased costs. So for average people all over California and all over the country, costs are going up.
Well, and isn't it also true that we've got sort of, you know, we're moving money from one pot to another pot in some ways, too? The young people are going to pay for the older folks' coverage. And what happens if those younger people decide not to participate? Maybe you look at a 169% increase and you say, I'm not paying that, and you opt out. Can we afford Obamacare if that happens?
Well, what will happen if young people drop out? And it's not just young people who are 25 to 30-year-olds or 34-year-olds. In the California example, the insurance of 40-year-olds will double also. So if those people drop out of the system, then what's going to happen is it's only going to be the very sickest people and the very oldest people, who are often the ones with the most health problems, who stay in the pool. But those people have higher average health costs, so premiums will go up. That makes premiums less affordable for everyone else. The government will subsidize those premiums even more. So you'll have two classes of people. You'll have one class of people that's heavily subsidized, the sicker, older people, and everyone else who can't afford health insurance.
Unbelievable. Well, I wanted to share with folks, you keep bringing up California, and I was looking at some numbers on the California insurance exchanges. So this is where you go if you want to buy insurance and you're not working for somebody who offers you insurance. You're facing, get this, in a silver level plan, a $2,000 deductible. Your doctor visit will cost $45 in copay and $321 a month premium. So $320 a month every month premiums and a $2,000 deductible. Does anybody think this is a great idea? Does anybody think this is saving money?
Progressives do, because progressives have this ideological commitment to people having very expensive insurance that covers a lot of things, even though, as you point out, it actually doesn't cover that much stuff. It's actually much better, more efficient, if you give people catastrophic insurance, which actually has higher deductibles, but where the premiums are way lower. And then you take some of that money and put it in a health savings account, save for your own health risks, your own health problems.
Well, we got lots of promises with Obamacare. Let's see if we can name a few of them. We thought our costs were going to get better. We thought we would keep our own doctor. It turns out we may not even have a doctor because we won't have enough doctors, and doctors are getting out of the business left, right, and center. Costs are going through the roof. Avik, you see any good news there?
That's a lot of bad news, and I think that's why Democrats are particularly worried about this issue. I think of all the complaints that have been raised about Obamacare, the one that I think that if privately Democrats worry about the most is this increase in the cost of health insurance for people who shop for it on their own, because that's something that's a pocketbook issue. It's not theoretical. Everyone will encounter it who shops for insurance on their own, and people are it's going to be a dramatic increase, and in 2014 we'll hear what the voters have to say about it.
We will hear what the voters say. Of course, it looks bad in all the polls, though. That's what we see. And we just heard this week that a lot of people in Congress, particularly Democrats, don't like Obamacare and may leave office because of it. Irony of ironies never ends. Avik, thank you.
Nice to see you, Jerry.
Thank you.